Nowadays, there are so many ways to have a beautiful smile. The technology and the advancements can make it happen. I'm at Carolina Family Dentistry with Dr. Scott Hewitt, and let's talk about some of the cosmetic things that can really improve people's smiles, starting with the tooth-colored fillings.
Well, the tooth-colored fillings are the only fillings we actually place in the office. So if you have a cavity on a front tooth and it's discolored or you want to have it whiter, we can always match it up to the other teeth to make it a lot more white. So we don't use the silver fillings anymore, so it just looks a lot more aesthetic and more natural looking.
What is the difference between a crown and a veneer?
Well, a crown, if you have a tooth that is broken down pretty badly and you want to restore more of the tooth structure and make it actually look more aesthetic, you can cover the entire tooth with a crown, and it's made of porcelain, so it just looks a lot more natural. Veneer, if you just have stained or discolored teeth on the front surface of the tooth, you can actually cover over that surface and make it a lot more natural looking by just basically putting that piece of porcelain on top of it, and you would never know that the tooth was discolored underneath.
Wow. Now, is this a process that is multi-step, or is it kind of a one-stop shop, or how does it work?
Well, it actually takes 2 visits. So the first visit, you would come in and you would get the tooth actually prepared for the veneers or the crowns, and then our lab would custom make it to how your teeth are actually made. And you would get that back in a couple of weeks. So during that time, you're wearing temporaries, which match how they're going to look in the end. So after you leave, you're not actually leaving with any holes in your teeth.
Okay,
so it's
good to know.
You actually leave and your teeth look like how they would look when you actually come back to get the final product,
wow,
which looks even better than when you left with the temporaries. So.
Now, some of your patients, you have some extraordinary before and afters. What is it like for the patient to see him or herself with that beautiful smile?
Well, when you show them the picture beforehand, they actually forgot what they looked like, and they see the picture before and then they look in the mirror after and they're really excited. Is
there a minimum or a maximum as far as patients that you can work with to do veneers or crowns?
If you want to do anything cosmetic, purely cosmetic, we usually don't want to do it on somebody less than 18.
Okay.
If somebody needs a crown because the tooth's broken out badly, you can always get a crown put on it, to restore the tooth. But anything really cosmetic like veneers, usually over 18 will do that, just so the teeth are all developed and they're not too young to really know what they're getting into before.
Okay, and what about the old, like my husband, baseball bat to the front teeth when he was about 10 and he lost his permanent front tooth? So that's a restorative thing, right? I mean, you gotta have
it. It is. I mean, nowadays we have implants, which they actually will re-implant structures back into the bone where the tooth used to be, so we can actually restore the tooth like it was never missing as well.
So many possibilities.
A lot.
All right. To learn more about all these different ways that you can have a beautiful, confident smile, just visit the website at www.carolinafamilydental.com.